الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وأصحابه أجمعين. فأعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. السلام عليكم ورحمة الله وبركاته. On behalf of Safe Hands Therapy and Veiled Velocity, I extend a warm welcome to each and every one of you to our webinar on exploring the art of hijama, tradition, science, and wellness. Today, we have gathered here with great excitement and anticipation to delve into the fascinating world of hijama therapy. I welcome all of those who are present here live and all those who will be listening to this recording on YouTube later on. It is indeed a privilege for us to collaborate with Safe Hands Therapy and Veiled Velocity, represented by myself, to bring you this enlightening session. Our aim is to provide you with valuable insights into hijama therapy and its role in promoting holistic well-being. I'm delighted to introduce our distinguished guest speaker, Saida Farhana Ahmed, a renowned hijama expert from Manchester, UK. With over a decade of experience in the field, Sister Farhana brings a wealth of knowledge and expertise that will undoubtedly enrich our understanding of hijama therapy. Throughout this session, Sister Farhana will shed light on the history, benefits, and modern applications of hijama therapy. We encourage you to actively participate in the Q&A session following her presentation, as it provides an excellent opportunity to engage with our expert and deepen our understanding of this ancient healing art. Once again, I extend my heartfelt gratitude to all of you joining us today. May this webinar be a source of inspiration and knowledge as we embark on this journey of exploration together. Thank you, and let us begin our enlightening session on the art of hijama. Before I delve into what we are going here, I just wanted to introduce my sister, Saida Farhana, who's been my friend in the UK while my journey in UK through hijama was. And she has been a great guide. And that's how I fell in love with the way she explains things. And I wanted her to be heard by you all. Jazakallah khair, Sister Mariam, for coming and accepting my invitation to this event. I'm just going to open your mic probably. Okay. Just open your mic and we can start up, inshallah. Are you able to unmute yourself, Sister Farhana?
Can you see me?
No, I'll ask you to start your video because I off. Now is it fine? Can you on your camera now? Yes. Yes, that's good. Okay. Sister Farhana, as we are here with our session where we are going, I was with the aim that we should do something like this, which is going to be recorded and which will be for a reference for others to help them revive the sunnah and whatever doubts they might have. So inshallah, let's pray to Allah subhanahu wa ta'ala that this brings something beneficial for anyone who listens to this today and some time later on, inshallah. I welcome you with great happiness and a great dua that Allah makes this successful. Sister Farhana, can you just give me a brief background of how hijama inspired you to bring in this field to you?
Assalamu alaikum everyone, and thank you for joining. Thank you very much, Lubna, for giving me the opportunity to join you today. Hijama is up. When I first started, I didn't even know I'm going to be a therapist. I'm 49 years old. I've got 6 children. All my children are grown up now. I had depression for a very, very long time. So somebody told me to get a hijama done. So when I got hijama done, I felt much better, alhamdulillah. So I thought, you know what, just to save money, I thought I'll learn it myself. And the more I learned, the more I started to do it on friends and family. When I saw so much healing, I thought I could do this from home. It's very, very easy. So this is how my journey started, and then I continued doing courses with different companies, different training places, and picked up a lot of knowledge. Alhamdulillah, and yeah, I am today. Alhamdulillah.
SubhanAllah. And don't you think that's how people do the best that they can when they choose a field which makes them interested in that, and they become the best healers, Alhamdulillah. I've seen a lot of people who got into any field and became the expert when they had something in their personal life. And that's why I wanted to ask you this question. Let's begin with the understanding of hijama. What is hijama and how does it differ from other traditional healing methods?
Hijama itself, there's different types of cupping you're going to come across: massage cupping, wet, dry cupping, fire cupping. But today we're going to mainly talk about hijama cupping. Lots of people, English speakers, they call it a cupping. Hijama is done by using a suction on the skin, using cups. So, you know, these are cups. These cups come in 7, 8 different sizes. We should have prepared things, you know.
Okay, I can see
them. Yeah. And then we use a pump. These pumps come in different sizes. So I don't know if you can see it in the camera.
You can see it while you're sitting on your chair. That's the whole picture. Yeah.
So we put these cups on the body in an area of pain, and we leave it on for a bit, and we draw out the toxins, and we do a little scratches. The difference between normal cupping or any other therapy is just scratches on the body. This improves circulations. It's different to acupuncture and other herbal remedies. People do feel much better. Alhamdulillah. It promotes a lot of wellness.
What do you think, Sister Farhana, is the great benefit being a Muslim and believing in this process of hijama? What
the benefit
that we can reap?
It's sunnah. It's sunnah, and the benefit is interacting with people, helping people really, and seeing the benefit. When you hear from your patients that become better, it makes you feel good. Alhamdulillah, Allah subhanahu wa ta'ala has put shifa in your hand, and that's amazing. Amen. Especially in fertility cases.
Alhamdulillah. Like especially when you are sitting in a place where English people are your neighbors and your people around you. Have you encountered experiences with them, and how were their feedbacks on hijama?
When I do get English or people from a non-Muslim background or newcomers, usually they don't know that hijama involves blades. Okay. So they're quite surprised. Some are scared, but then I try to divert their attention and tell them, you know what, you'll feel okay, you'll be fine. And the process is good, alhamdulillah. English people do find it very fascinating, very different. So once we do get non-Muslim or people from different cultures in, I find that you get lots of other English people coming in as well.
Yeah. Especially when I was there, I noticed the thing that in general, the humans are of the thought that they should try something new. And especially in places like UK, I've seen that people have tattooed their body so much that even their face is not left out. In that case, hijama is something very small for them.
Of course.
Isn't it? Do you agree with me?
Yeah, of course.
Okay, can you explain, can you tell me what are the current awareness of hijama in Manchester and UK at large?
Right, what number are we on? We've jumped some questions, haven't we?
Yeah, like I just want to share with me the scenario of hijama and its practice in Manchester, and you can just compare how it was back then when you started, and to comparison to now, the amount of awareness that people have right now.
There is a lot of increased awareness now in alternative therapy. I think since COVID, people have chosen to go for alternative therapy now. People that have been on long-term medication are trying out more natural things, because with hijama, the difference is we're not putting anything inside the body. Literally, we're getting the toxins out of the body. In Manchester, it's an amazing place, Manchester, because it's very, very busy, and you've got different people from different community backgrounds. So I think still there is lots of awareness that we need to make people aware of, but there is still people doing hijama as well, but they learn the courses and I think they just leave it. Lots of people should start getting into it more.
You mean that still it needs a lot of work and a lot of awareness? But compared to that, which when you started as a therapist and when you started training people, let me tell the audience that, mashallah, Sister Farhana is one of the accredited training provider from IPHM. And IPHM is an international board of holistic medicine, which certifies people only on the basis of their practice. Alhamdulillah. Not only that, she's a good practitioner, and she's also providing training to people in a very professional manner, mashallah. And she's right now in her clinic. So I was just telling this part, Sister Farhana, that the awareness, the amount of awareness that was there a decade back is completely different from what we have now. Is it the same case in UK, or is it different? Because in India, it was like we had to explain to people what the procedure is, and then we had to give a lot of amount of trust to them on doing this procedure. But now people, they themselves inquire and they want to get it done. Can you just share with me what's the experience there?
Yeah, there is a lot of social media. So from social media, people do pick up lots of things. They want to try different things. I know hijama itself, because it's blood related and because there's blade involved, lots of people do get scared. And I think it's just that part that scares people off, some people, until they come here and I tell them, you know what? It's okay, it's fine, or experience they might have in different other places. Hijama itself is not painful at all. Once they get in, they realize, alhamdulillah, it is actually a really, really good type of therapy.
Yeah, mashallah. What are the cases that you've dealt with and you feel that these cases are more, hijama helps these cases more? What are the cases that you deal at a daily basis?
I think the top few would be back pain. I think every other person would have back pain.
Yeah.
Migraine is another one as well. Lots of people have migraine. Lots of people are tired. Lots of people are stressed. So these cases, I think they feel straight away, alhamdulillah. While we're still doing the hijama, they will feel a relief.
Mashallah, mashallah. Are there specific conditions or ailments for which hijama is particularly effective, like you said now? Apart from that, apart from the pains, did you find any cases that you thought probably, or the people will think that how can this case be dealt with hijama? Was there any surprising case that you dealt with?
I think the most biggest case I have come across is I treated a Malaysian sister. She was in her 40s and she had cancer, and she came to me, and I didn't want to do it. I was very, very scared. So I started to do a lot of research, asked a lot of other therapists. Everyone kept on saying no, but one or two says, yeah, okay, do it. And I said to the lady, I'm in two minds. I'm very, very scared. So as sadqa, I did it. Alhamdulillah, she felt much, much better. I think that was one of the biggest ones that I've done. She's felt better. She's still my patient. She still comes in and out.
It matters so much when the person who's wanting the treatment gives us that much amount of trust in the procedure, so that we also get it done with that much amount of trust and comfort with them, isn't it? Unless the patient themselves have that amount of belief in the process, that helps a lot in the healing process, isn't it?
Of course. And I think, like with everything else, even medicine, we're not some kind of magicians. We haven't got a magic wand where you come in and that's it, you're going to be cured. Shifa is up to Allah. But I can say by my experience and by lots of patients that have come in, I've not had any negative kind of review. If you look onto my Google page, you'll notice, and that's very, very shocking, very, very shocking that actually most people feel much, much better.
Yes, alhamdulillah.
Some people straight away, some people it takes a few therapies to feel better, depending on the case, depending on, how long they've had, whatever they've had.
Yeah. So my next question is it only those who have health issues be benefited by hijama, or are there benefits that are primary health benefits from hijama that people can experience? Like if someone doesn't have any health issue on a normal basis,
I
but
think that's a massive question, because lots of people think, oh, I don't need hijama. There's nothing wrong with me.
yeah,
There doesn't need to be anything wrong with you to have hijama done. Hijama can be done as just a precaution, something that might happen to you 5 years down the line. Alhamdulillah, when you do get hijama done, I'd basically demonstrate it as you cleaning your car, changing the oil in your car. Once you change the oil in your car, the car looks smoothly. So really, it's really doing a little MOT for your body.
yeah. You say MOT, right? That's like kind of a workshop where car goes for a repair or a rejuvenation. That I agree a lot with you in that case, because even I see that a lot of hijama enthusiasts, they say that you feel like a Ferrari after you have done your hijama done.
That want to really try. I think it's the youngsters are more fascinating.
Yeah.
The old generation, not very old, I wouldn't say old, but the other people, they would come in with aches and pains or some kind of medical issues, but the younger generation really come in to try it.
Yeah. So these are all the practical aspects that we are discussing. Definitely, there are a lot of scientific things that go behind it. But usually, people do not speak of all these things. You know, when you're going into a course or something. So definitely, I would want or extend an invitation to all my listeners here. If you really want to certify yourself, or you want to learn deeper or a deeper knowledge or the science behind hijama, you can definitely get in touch with us and Sister Farhana there, who can even certify you on the behalf of IPHM, which is an internationally accredited organization. Further ahead, Sister Farhana, I would like to ask you, what are the safety measures should a practitioner and the clients be aware of during hijama sessions?
Safety measures is making sure that we do risk assessment. Now, lots of people think that everyone is suitable for hijama. Lots of therapists will tell you that everyone's suitable for hijama and it's been going on for hundreds of years. No, everybody is not suitable for hijama. So making sure that you do a thorough risk assessment, making sure the equipment is sterile, you've got safety equipment. In the UK, in some countries, you're not even allowed to do hijama, like like Canada, Australia. We've got, I could name all these other countries. But in the UK, alhamdulillah, they've given us the opportunity to be able to do hijama as long as, we're certified and, we've done the course. Safety is very, very important when it comes to hijama. And I think a lot of therapists do learn it, but the safety side, they do not follow. And that's when everything starts to get messed up. And hijama itself is a sunnah, it's an amazing therapy. Hijama is not bad. It's the therapists that don't do it properly that gives hijama a bad name.
Such a great point put forward there, because it's the same like if people see a bad Muslim doing something wrong and then they say that Muslims are bad, or these cult of people are bad, they stereotype something like that. It's the same thing with the hijama therapist or the hijama therapy, that there are so many people who do wrong practices and hence they bring a bad name. And that's something that we are fighting as therapists now, because there's so many people who have come up who don't have the knowledge of hijama properly, and they are just going and cutting up deep, right? So let's talk on that as our next thing, that is how deep should the cuts be, and is it the blood that comes out that is healing you, or is it the cut that is healing you? What light can you shed on that?
Right. Hijama itself, right? I've had another post I've seen. Hijama itself is an artificial attack on the body. So the body thinks that it's been through a massive attack. The cut itself is very, very light. The pump does the work, the cups do the work. Now, every single person bleeds differently. Women tend to bleed far less than men. Men bleed quite a lot. I think Allah subhanahu wa ta'ala has made us women because we have periods. So, and even women don't have to have as much hijama as men do. Men are recommended to have hijama a lot. So I forgot what the question was. Is
it the blood or the cut that is important for the healing to happen?
I think it's more internal, sister. It's internal. Lots of patients think that when you get hijama done, the more blood you lose is
That's
better.
what I wanted to bring out. I just wanted to highlight on that point.
Sister, that is not the case at all. I had a few people actually, and they come in and they would criticize my work and say, you should have to leave the cup on the body for more longer. I went to another therapist and they put the cup on 3 times in that area. You can't put the cup on. First, we do dry cupping, so 5 or 6 minutes, and then after the cups, we do the wet cupping, another 5 or 6 minutes. That's sufficient. 40-45-minute therapy is more than enough for hijama cupping. If you keep the cup on the body for too long, that area starts to blister.
Yeah, that's right.
The patients are going to start complaining.
Yeah.
So there's a lot to learn over time. You realize that safety is very, very important. It's not what a patient wants. We as a therapist need to know what is safe to do on that patient.
Yeah.
Also very, very
just want to share the same over here. Like here we practice like we put the cups for 3 times, but it matters how much time you're putting it for, right? Sometimes if you're leaving it for longer, whether it be twice or thrice, but if it is longer than needed, that it might bring up the blisters. So whether you're putting it for 2 or twice or thrice, it doesn't matter, but you shouldn't put it for long. Where thought is behind, where you're bringing a lot of blood to come out, because it's an intelligent process, isn't it? The body knows where and how much blood to come out.
Yeah. Again, lots of therapists listening to this may disagree on that point. Every single therapist is different. Everyone's treatment is different. Everyone's way of working is different. I have found that it does take up a lot of time. If I sit there and start putting the cups 3 times, 4 times, I'll have that patient in the room for 1.5, 2 hours. So I haven't got time to give someone 2 hours. I've got to get them into their therapy and alhamdulillah, let them leave. And women do tend to sit there and they start chatting. So it does tend to waste a lot of time, especially when you're in a busy clinic. But every single therapist is different, I think, the way of.
Yeah, looking at from a therapist point of view is something different when you're planning up a patient who's coming down to the clinic and how much time you're going to give them. At the same point, I would like to highlight the things that sisters who are listening and the therapists who are going to listen to this lecture at any point of time in future, you need to remember that it's not the amount of blood that comes out that heals you. It's the hadith that emphasizes that healing is in the cut of the copper. So if the cut happens and whatever comes out is on the natural process, it's not at all the amount of blood that's going to decide how much healing you're going to have. So that's something that you need to remember. That's what I just wanted to do.
I just wanted to ask, not ask, sister, I wanted to add, Sister Lubna, I see horror stories all the time. I see patients who've had hijama done in different countries, Libya, Somalia, and they've said they've had it done 3 or 4 years ago. I look at their back and I can still see their marks.
Yeah.
And this is very, very scary because that means they must have had a very, very deep mark.
Yeah.
And that's, that is a put off to anybody who wants hijama done, because if you go to a good practitioner, your therapy is going to be good. My marks, I will say, alhamdulillah, 3 days to probably a week is the most that a mark should last. Your marks should be gone. In UK, you would need insurance to practice on patients, and therapists that are practicing, I would really say that have insurance, even though you never need the insurance. I've never had to use my insurance, but insurance doesn't cost much. But at least you know that out of 100 patients, there might be that one patient that will, take you back.
Yeah. Just reminded me of one case where I had a patient turning up and they had plus and minus marks on their back, saying that the therapist in the first sitting would do cuts in this way, and the second time they would go the horizontal way, one vertical, one horizontal. I was like, okay, this is an art canvas for them. Is it so? So those marks are remaining, and then you can see all those plus minus proton electron marks on their back. So which is something really disappointing, where people have put their marks on people's bodies and they are so visible even after years of their therapy have been done.
Yeah, and with diabetic patients, sister, the healing is much slower than a normal person. So with a diabetic person, some people use a pen. I don't know if you are aware of the pen that I've never used a pen because it makes like a clicking noise when you use it. So what I do little dots with the blade when I get diabetic patients. They leave much marks. I think it is the marks that scare people a lot. Now, if you have some kind of underlying issue, some people tend to hold the marks. That's another thing as well.
If they have issues,
it's not you, it's probably them.
Yeah. Like you discussed of the cases that we've taken, like, some challenging cases like the patients with cancer and all. Are there any contraindications or situations where hijama should be avoided?
Should be avoided, right. With hijama, you do a risk assessment. So there's about 10, 12 questions. Pregnant people, definitely not. Heart patients, definitely not. People on blood thinning medication, not. There's quite a long list, actually. Some of the major ones, I would say totally avoid them. Don't even bother even going into that, because you're going to have something on your hands that you don't want to deal with. Some you can do. If you're an experienced therapist, you can. I've done epileptic patients as well, but with care. Because I know what I'm doing. Anemic patients, again, you have to be very aware, because they can feel very lightheaded. They can fall on the floor. So I get my patients to lie down on a hijama. Okay, so even if they're feeling lightheaded, they've got their head lied down. I think a lot of therapists do their hijama on chairs. Even if it's a big woman, maybe she doesn't want to lie down on her stomach, so you're doing it on the chair. When you do hijama, lots of people feel lightheaded, so they tend to, some might even fall on the floor. So you've got to be very, very careful when you do hijama patients.
That's true. How does hijama connect with cultural or religious practices, especially in the context of Manchester's diverse community that you have around you?
Right. Most people who get hijama done are actually Muslim. Alhamdulillah, I've got to say that. There is a few here and there that are non-Muslim who want to try hijama just for pain relief, or from the medical aspects of it. Yes, we do in Manchester. There is quite a lot of Muslims, so alhamdulillah, we do target quite a lot of Muslims.
That's good. How do you address any misconceptions or concerns people might have about hijama? It could range from anything. So can you just start with one thing that you think could be a misconception of hijama?
Safety. You got to be very, very.
No, did you get my point, Sister Farhana? Where I just want to focus that people have misconceptions about hijama, like it might bleed a lot, they might fall, like how you said, people might fall on the ground, or people will fear that they'll feel anemic after hijama, things like these, So how do you address to them on these cases?
When somebody calls you, inquires about hijama, make sure you tell them that you're professional, you have knowledge, you're able to answer all their questions. Anything they ask, you're able to answer that. There is lots of misconception, but be ready to answer these questions. There's nothing that we don't hear. There's all sorts of things that we hear with hijama. So it is generally very, very safe. I wouldn't say there's There's not anything dangerous about hijama. You do get lots of therapists, I would say, do tend to make up stories, or this means this, or blood means this, or this might mean this. So I would ask them not to really believe a lot of the stories, because we are hijama therapists, we're not Rakis, so they have to understand all that as well. Lots of patients that do come in the risk assessment, I always add, are these patients afflicted? Now, subhanallah, hijama is such an amazing thing. Not only is it good for our body, mind, is also spiritually is amazing as well. And it does pick up on afflicted patients. Now, if some people are afflicted, it does pick up on that. I'm not trying to scare anybody. So out of 100, I might see 1 or 2 afflicted. Because I've been doing it for many years, I think I'm able to recognize some of them. So there is a lot of it.
Sister Farhana, by afflicted, you mean someone who's suffering from any spiritual disease or something, coming on them, or jinn or something like that?
Yeah, so not to be scared of, because it's not as if you're going to see every other patient is not afflicted. So don't be scared. I know that sometimes this might be a bit of a put off for some therapists. And I think that when people do get these kind of patients, I think they do get put off. So that lots of therapists give up on hijama after they come across one or 2 of these patients.
Yeah, and with that, you brought in a very important discussion on that, because that's something very interesting to talk about these days. Does hijama heal people afflicted with spiritual issues, like anyone with depression? These are like small things nowadays. Depression and anxiety are small things, but something where people feel that they are afflicted. How do you experience people like these who actually might not be afflicted but are in the impression that they are afflicted?
Again, with experience, you've got to understand that there's a lot of psychological issues that people might have. They might have gone through so much things in their life, and they might think, okay, this is due to black magic, this is due to this is due to this. Not everything is black magic, and not everything is jinn. So we as a therapist, we have to understand that. We can't tell them, oh yeah, yes, you have got a jinn with them, and that will make them more scared.
Or probably there are so many people nowadays who are feeling a bit, satisfied that they've at least found some solution, or some one who can agree with them that, okay, you're afflicted, that's what I feel nowadays people are doing.
And another thing, sister, I want to mention, and I found that massive, really, really big among therapists, that a lot of therapists tell patients that they're afflicted.
Yeah.
It's really, really bad, and it's really, really sad case out there. We are hijama therapists. There's no way that we are going to know if a person has got black magic or if they've got jinns and stuff like that. Even if we do, there's no point in telling them. The cure comes from Allah subhanahu wa ta'ala. So, we're here to cure people. Shifa by the will of Allah, really. So I think lots of therapists need to not mention all that to patients and scare them.
Yes, that's true. How do you ensure a compassionate and respectful approach to each client? Like, how do you ensure that? Because sometimes when clients come in, it's not just hijama that they are expecting you to be giving. There must be something else that they're expecting. So how do you deal with them, and how do you care about them?
I always do a risk assessment, and I always have a form. So I fill up the form, make sure I know what we're dealing with. They sign the form, and we've got insurance. So I always tell them that we're fully insured. And, if you have any concerns, contact me, or, you got this as a backup. So people do feel safe when you tell them that you've got insurance. And it is very, very important to have insurance. Nothing really does happen, but that is really good. And being able to understand and speak to patients, really.
Yeah, that's really right. Do you have any advice for those interested in pursuing a career in hijama?
It's amazing. It's amazing. It's absolutely amazing. I'm a mother of 6, and I would say all my life I spent looking after my children, and I've never had an opportunity to do a full-time job. I wear a niqab, so for me to find a job was very, very hard. I do this from home. So one of the rooms I've turned into a clinic. This is amazing.
That's quite interesting. Tell us more about it. How it's helping.
I would say, if you do go into hijama as a career, don't go in for the money. The money will come anyway. You have to be a very soft-hearted person, a people's person, have love and care for person, understand person, being able to talk to person, have a lot of sabr, because lots of people are going to sit. You're going to see many sick people, many sick people. So, have lots of sabr to be able to get into this. It's very easy. There's nothing really major about it. So don't be scared. Oh Allah, do I need this degree? Do I need that degree? No. Hijama is very basic. It's more practical is hijama, I would say. And I think anybody can put a cup as long as you know the safety side of it.
That's really true, sister. Because nowadays the need of it is growing so much, and we need a lot of therapists out there. Whether the similar kind of a journey that you are already in, where you've not never been to a medical school, but then you've been a healer, mashallah, for so many years, and that's kind of an inspiration for all of us. And that's what I want to bring out to all my audience here, and anybody listening to me the webinar later on, that please mind yourself that even if you're coming into a field like this, if you are equipped with proper knowledge and the pure heart to heal people, I think that will make the difference. That will make the major difference in what you're actually pursuing for, isn't it, Farhana?
Of course, it's amazing. The money is, mashallah, it's amazing. It's amazing. Once you get going and you start getting busy and people start knowing you, you'll notice that you do get there's a lot of barakah. I tell my students, thank Allah when you get into this profession, that Allah subhanahu wa ta'ala has chosen you to become a hijama therapist and to revive beautiful sunnah. So, once you feel grateful and gratitude towards the work, I think the work runs smoothly.
Okay, Sister Farhana, with that, I would like to ask you that if someone wants to learn from you and connect with you, what's the source and how do they get in touch with you to even get a course done by you or something like that? Can you just give us the details?
Right. My hijama courses are a 2-day course. So day one, we talk about the benefits of hijama, all the legal aspects of hijama, who to do hijama to, who not to do hijama to. Day two is more practical. Now, hijama is more practical. The knowledge behind it is more of the risk side and the safety side of it. As soon as you've completed the course, if I think your work is good, you go through a little exam, and then I'll give you your certificate and you're able to work. Once, I would say, spend at least 3 to 6 months practicing on friends and family before you do it on public. Have insurance, and alhamdulillah, you'll be able to do it. If you're in UK, I'm in Manchester. I've had patients, students that have come from abroad. So, however you want to contact me, you may contact me.
So your center is Mariam's Hijama and available on Google as well in Manchester, UK, right?
Yes.
And do you have any number that goes with your clinic so that you can just share with us now?
If you Google Mariam's Hijama Manchester, you'll find a lot of information on there. I've got information about hijama, information about the courses.
That's great. And you have a video on YouTube as well. I'll be sharing with my audience here, and you can just check out Mariam's Hijama Manchester, and you can see a few videos of her clinic being put on the media there, mashallah. Also, one last question, Sister Farhana. How can clients make sure they choose a qualified hijama practitioner? Are there any signs and symptoms that you can see whether they are well-practiced therapists or not?
Right. When people want hijama, the first thing they go for is money, and that's the wrong approach. Okay. And there are students who've, learned 2 months ago, 3 months ago, and suddenly they're getting out in the public, practicing it for, very cheap. That is not the correct approach at all. So look for a therapist who has got years of experience. They know exactly what they're doing. a therapist, if you ask for their qualifications, they won't be unhappy to show you. They'll show you. They'll know Sunnah days. Sunnah days are very important with hijama. Lots of people get it done on Sunnah days. They'll have a little bit of knowledge, background on hijama, know that, and look at their website, look at their reviews. Inshallah.
Yeah, social media has made it a lot more easier, isn't it? Like they can go online, check their reviews. Nowadays, people are on the social media having their videos coming up and letting people come in the clinic even before they walk in the clinic, isn't it? So that makes it even more easier. Sister Farhana, just for my information and the people listening to you here, can you just share how many students have learned from you till now?
I don't want to disclose that number. Alhamdulillah. Alhamdulillah.
Alhamdulillah. So I just wanted to put you up with this point that mashallah, she's trained a lot of people in the UK. And how do you ensure, Sister Farhana, that people who are learning online from you, how do you ensure that they have learned the process correctly?
Right. Actually, I don't have anything online because I don't feel hijama you can learn online.
Okay.
But I have students who've lived far away. So this is a 2-day course. Day one, we read through the brochure. So yes, day one, we can do online face-to-face and we can talk about it. But day two is practical. So the practical, you have to come in for the practical.
So you make sure that they come to you and learn, right? Yeah,
so
that's a great thing that someone should have the hand, because if someone doesn't have the facility of seeing someone and understanding whether they are doing it correct or not, it does make a lot of difference, you know, because anything online, because nowadays a lot of courses are there up online where they don't have this, facility where they can see personally, one-to-one, physically seeing a teacher and understanding the depth of the cuts and all. But still, alhamdulillah, that's also working. Learning online is also a big thing nowadays. But I would really suggest all of you who might be looking forward to in a career in hijama therapy that you have someone whom you do the hijama and they look at what the procedure you're doing and ensure that you're doing the right amount of cuts and the right amount of depth, unless, you know, because that will take you to the wrong path of the practice, isn't it?
Yes, that's correct. And my students, alhamdulillah, we don't just do the course, give you a certificate and tell you to go and leave you out in the world. When I did my course, it was very, very scary because I didn't know what to do, where to start, how to start. It was very, very scary when I first started. So I learned a lot by myself, and my students, I make sure that we're always in touch. So every single one of my students are still in touch. You know, anything they do, they approach me. So we never let go of you. So don't worry about that.
Jazakallah khair, Sister Farhana, for that. And now I would like to open the floor for any questions coming up from our audience. Is there any question? Please raise your hand so that I can unmute you, or you can unmute yourself. Anyone having any question regarding hijama or anything that you feel we might have, we should have talked about, but we have probably forgotten to speak on that. Anyone having a question? Please make use of this opportunity and ask a question to Sister Farhana. Probably you'll get a very good answer. Okay, until we get a question, Sister Farhana, I just want you to put some. Okay, Sister Umdar, you have a question. Please go ahead.
Assalamu alaikum, Sister Farhana. It's been very nice listening to you. Just wanted to ask about that. You said you dealt with depression and mental health issues before you started this hijama thing. So how much it helped you, and what were the things you were doing at that time?
I couldn't understand. So if you can repeat it, my mic's not good.
Yeah, because the sound was a little breaking. So can you just repeat, Sister Umdar? Was it a feedback?
Hello?
Yeah, please repeat. Yeah.
Yeah, I was asking Sister Farhana that she said that before she started this learning hijama, she was dealing with depression and mental health issues, something like that. So how much has Hijama helped her? How did she deal with that using Hijama technique?
Yeah. Okay, I got your question now.
Yeah, I think she's asking about my own experience,
Yeah,
right, Yumda?
Yes.
Right.
Exactly.
I've had depression for a very long time. I'm nearly 49 years old. My eldest daughter is 29 years old. After my daughter was born, I started to get it's a baby blues, Lubna,
Yeah.
postnatal depression. And
Yeah.
I think I was overwhelming. I was having postnatal depression. Now, every time I had a child, I went into this postnatal depression. So I'm going to let you into a story. 4 of my children were taken into care because my depression was so bad. I couldn't clean my house. I couldn't cook all day. I just felt like sleeping, sitting down in one space. I didn't want to do anything. When I got Hijama done, I didn't even know what Hijama was all about. A friend of mine said, get a Rukia done, because Rukia and Hijama go hand in hand as well. So they said, get Rukia done. So I went for a Rukia session and they were doing the Hijama as well. So I think it's more of the Hijama that worked really. So Alhamdulillah, after I got the Hijama done, I felt much better, because now you can see all of you, you can hear me. I'm very hyper. I've got a very hyper.
No, that's such a great example that you have created, that, from that journey of yours to this journey of yours, where you are a trainer of Hijama. That's such an amazing story for us to learn from you. Alhamdulillah.
Since I never worked, I never had a full-time job, because most of the time I was looking after my children. To be able to start this in my 40s and start it and have children, I think anybody can start a career in Hijama. And in these days and times where people are struggling financially, I would say, subhanallah, do it. Start this career. It's amazing. We need a lot of people, healing hands, to be able to start this career. It's absolutely amazing to connect people.
Yes, sister. Something connecting to that question. Zarina aunty, you have a question? So I was asking you the similar kind of a question. Like nowadays, mental health is at the epitome. Yeah, Zarina aunty, you have a question?
स्पीकर पे आ गया, फिर उसके बाद स्पीकर
You can type if you want, sister Zarina aunty. If you have a question, you can type up. Like how Sister Umdat was wanting a bit of light on how Hijama will heal the depression and anxiety. How is it gonna affect the body and mind in that case? Like from your personal experience, like immediately after Hijama, how was the things changing in your life? Can you just share with us?
I would say I felt much lighter, much more focused, more energy in my body. Now, every person is different. Everyone's depression is different. Everyone's reason for being depressed is different. I think now, with all the struggles and financial struggles and all the things happening after COVID, I think lots of people are suffering from depression, and it's very sad situation out there.
Yeah, that means the need of Hijama therapists is even more after the pandemic, isn't it? So extending an invitation to all my listeners here, that please go ahead and hop on any course that might help you become a therapist. If you have the mindset of becoming a healer, I think that would be a great benefit to the community on the whole, at situations where depression is at a high and mental health is being declining even more, with great numbers out there. So with that, I just want to ask anyone having a question can raise your hand. If not, then we can go towards the close of our session.
Sister Lubna, fertility is another big thing as well. After COVID, I've noticed there's a lot of sisters who suffer from PCOS, especially younger girls. Period problems, are suffering the irregular periods, finding it hard to get pregnant. With Hijama, there's a lot of success rates of getting pregnant. Subhanallah, amazing. I think these are the biggest things that I like, is when I hear a patient has got pregnant. I had a lady, the first patient that got pregnant, I was very, very surprised. She had polycystic ovaries. Now, her doctor said she's never going to get pregnant.
Oh, subhanallah.
Because operation, even maybe that she may not get pregnant. She only had 2 sessions to become pregnant. So I was shocked. Alhamdulillah, it's amazing. It's amazing therapy.
Subhanallah. That's like one of the quite rewarding patients that would be, yeah, for infertility, because that's coming like in the form of a human being as a result, isn't it?
Sister Lubna, I've had people, physios, I've had doctors, psychiatrists, now people from different medical background have come in to learn hijama. Now, what does that say about hijama?
SubhanAllah. That means quite a lot of work needs to be done. And what do you think? What would you like to say on that? Why would these people want to come and learn?
Because I've heard so much good things about hijama. Lots of people are probably asking them, do you do hijama? Is hijama good? They've probably seen the benefits, but now they want to know what's going on.
Yeah, the business is going somewhere, right? Sister Sister Farhana, before we end the session, as we have touched most of the important topics today, and there might be more topics that we need to delve into, because this amount of time is not enough to speak on every aspect of what we've discussed today. I would like to ask you if you would like to give your feedbacks on how you felt attending this session and giving your insights on this session. Sister Farhana.
Right, okay, right, sister. If anybody wants to contact me directly, they've got my number. So any kind of questions, I know I'm feeling a bit anxious because very rarely that I go online. Personally, if anybody wants to talk about a situation, or if you're in India and you want to approach a therapist, I can write out the points, or I can ask you what to ask them or what to look for. Inshallah, I'll be able to guide you. So there's no in that, or how to
Jazakallah khair for extending that amount of help from you. Alhamdulillah. That's what I like about you, that you've always accepted our invitations to any kind of collaborations that we have earlier did with you. Jazakallah khair. I want to extend my deepest appreciation to our esteemed guest speaker, Sister Farhana here, for sharing her expertise, wisdom, and passion for hijama therapy with us. Sister Farhana, your dedication to promoting holistic health and well-being is truly inspiring, and we are grateful for the invaluable knowledge you have imparted to us today. I would also like to thank Safe Hands and Veil Velocity for availing this opportunity of collaborating with you for the cause of holistic wellness and your efforts in facilitating this event. To all our attendees, thank you for your active participation, insightful questions, and eagerness to learn. Your engagement has made this webinar truly interactive and dynamic. As we conclude, I encourage each of you to reflect on the insights gained today and consider how you can incorporate the principles of hijama therapy into our own lives and communities. Let us continue to explore, learn, and grow together on our journey towards holistic health and well-being. Finally, I invite you to stay connected with Safe Hands Therapy, Veil Velocity, and our esteemed guest speaker, Sister Saida Farhana, for future events, resources, and opportunities to deepen your understanding of hijama therapy and other holistic wellness practices. Once again, thank you all for your presence and participation. May you be blessed with health, happiness, and prosperity. Jazakallah khair.
Thank you, everybody. Assalamu alaikum.
Alaikum assalam. وآخر دعوانا أن الحمد لله رب العالمين سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب. Assalamu alaikum all. We can see you in another session that's going to come next Saturday. Assalamu alaikum.
Alaikum salam.